What are those called?
Okay, so these ones here are called appendix retractors. So these are baby appendix. They're little tiny ones, baby appendix. And these are identical, but they're just a little bigger. They almost look like Richardson's, right? Right? So these are called appendix retractors.
Okay.
Okay, babies. And so I usually just set them so that I can see them, like when I'm setting mine up.
The
You know?
physician, sorry, will ask for the appendix.
Yeah.
They'll actually call on that.
Yep. Yep. You know, so that it's easy for you to see, you know. Okay. And then these are Langenbach's. Or they'll call them long appendix.
Oh, okay.
Yeah, depending on the surgeon. My boot just
My
did
grade.
something funky. Okay. So, and then this would go over to, so now for prepping of the breast, we use pink. Now, if you guys, if we were gonna count this, what would we do? Do you think we'd do a full count or just a small count? For
Never
this?
seen a full count.
We're not going to cavity though,
No.
so no.
Okay.
Breast isn't considered a cavity?
No.
Really?
No. Because it stops at the chest bone,
Oh, okay.
right?
Makes
So,
sense.
yeah. But, I mean, believe it or not, you'd be surprised how you can actually lose something like this right in a breast. Because they'll stuff it in, right? If they've got bleeding or if they're doing like fluid there, they'll actually stuff this right into the breast, right? Yeah. And then you just got your other stuff here, right? There's not a lot left on it, just Steries. Ooh, a 10 blade. We have no, we're out of 10 blades and people are actually like sticking them in their pocket when they find one, right? And they said they're gonna put it on Kijiji. 'Cause we can't find it.
And you're
We have-
wasting one on your students.
Oh, I'm gonna put it in my pocket. Okay, so basically for this case, you would do your sponges, you do your 4x8s, you do your syringe and needle, you would do your pen, cap, and ruler, your blade, and then any sutures that we would open. Also, we've got hemo clippers. You guys have seen these, haven't you?
No.
No.
Just the bigger ones, not the little ones? Okay, I'm gonna get some hemo clips in. So this one, you can see the colors, right? There's red, which is those little tiny ones, and blue.
Oh, okay.
Okay. So I'm feeling generous tonight. Right. Okay. And there's different types. I'm actually want to find one more. There's different types of pencil bovie tips. This is a pencil bovie, right? For burning. This one here, if you look at the top of it, it's called insulated. So it actually only burns between there and there. Do you see what I mean?
Sheeted area there.
In that little shaded area. This is always used for breast because it's such delicate surgery, right? When you're like into like bowels and stuff, it's more intense, right? You want like a nice big burn area, right? But especially on the skin area, you want just insulated. Okay. These ones are needle tip ones. I'm actually going to open one up to show you. They're sharp, so they're a little needle. They're actually a little needle tip. These we're in ENT. This is the ENT room, so ear, nose, and throat room. So they use that for cauterizing the nose, that sort of thing. So where they just want to get to one section, just a little pin, right? When this one here, this is where they do it. It's just, it only goes to there, so it doesn't burn very deep. I'm gonna go get a different one. There's none in here. And what these are used for, is when they're doing a reduction. So there's a normal one right there, right? Is they're gonna put the breast together. So they actually take the baby towel clips and they actually take the incision and they put it all together, right, on both sides and kind of walk to the end to see if they look, you know, reasonable, right, and they come together okay. So that's what, there's all kinds of, actually we have a surgeon that does mastectomies that uses baby towel clips too. Just to make sure the incision comes nicely together, so that when he's sewing, there's not gonna be a big gap or a big, you know, so he'll use baby towel clips. This great big thing here, this is just a large Kelly. It's weird, but this is how they do it, is they take the breast, right, when they're doing a, and I mean, it's hard to picture this, right? But when they're doing reduction, it's really pretty, it's not a pretty surgery, really, right?